Hello classmates, my name is Chloe Rowland. I have been an RN for 2 years now. I currently work at Caramont Health in Gastonia in the medical surgical ICU. However, I am leaving in a couple of weeks to start in the medical ICU at Atrium Health University. From this class, I am hoping to gain more professionalism as a nurse and climb the clinical ladder. I think there's a lot that goes into professionalism as a nurse, but my definition of professionalism in nursing would be, how do we respectfully, ethically, and competently provide care for our patients? A big part of that is how we're communicating with each other, other nurses, our colleagues, physicians, and how we're communicating with our patients and their family members. I think that personal accountability and compassion are really big parts of professionalism as a nurse. In my own practice, ethics influences a lot of things, especially in the ICU setting. We have a lot of ethical issues that arise, such as families wanting to reverse advanced directives for their loved ones that they've already chosen when they were not incapacitated. This would be the patient signing a DNR form, already having a DNR form and their family reversing it, but in North Carolina, it's legal for your next of kin to reverse your DNR. So my role as a nurse professional would not be to provide my opinion. My role would be to advocate for my patient, but go with the wishes of the family member. You can always get the ethics committee involved, and that's a whole another rabbit hole. There's a huge compassion component in professionalism in nursing, specifically in the ICU. We see a lot of death and dying, and our role is to provide comfort during those times to patients and family members. We are often the bearers of bad news. Sometimes our role is to deliver the bad news with professionalism, truth, and clarity. Our role is not to fix the grief. An example of that is in the ICU, 2 nurses pronounce the patient when they expire. So to tell somebody that their loved one has passed away can be a hard thing to do in a professional sense. I think that in the lifelong learning sense, as nurses, we are lifelong learners. There's always new evidence-based practice coming out. We should always be looking at evidence-based practice to enhance our professionalism in our career. That way, we can provide more competent, respectful, dignified care. Responsibility and accountability are huge parts of the profession. We are our own people working under our own license, so we take responsibility for every action that we do. So, for example, my professional accountability, if I make a med error, it's my responsibility to inform the provider, to monitor and assess the patient for bad outcomes. I think it's very important for us to recognize different social determinants of health and how they affect patient outcomes. If we can identify certain social determinants of health in a patient, it could potentially increase health equity and fairness for all of our patients. It could definitely improve patient outcomes. Lastly, my motivation for completing this degree is to just learn more and grow in my clinical practice. That's really all I have to say. Thank you for watching.